So I'm really excited about this new appointment. I haven't worked in the education sector previously. I'm a medical doctor by my background profession, but embarking on this new journey with Regent Business School is extremely exciting. It's a brand new challenge and I'm ready for the challenge. And the reason why I'm so enthusiastic about it is because I have an opportunity to link healthcare and clinical medicine with improving management and leadership amongst healthcare professionals, and I'm able to relate to both. And this is what's driving me to try and help empower people and make the necessary changes in the healthcare industry. So the COVID-19 pandemic has really been an eye-opener in terms of the drastic amount of inequalities there are within our healthcare systems locally and even internationally. And these inequalities are something that really needs to be addressed. The sectors within healthcare itself are extremely fragmented, and the provision of care to vulnerable populations is far from adequate. And hopefully by helping educate people to become stronger, braver leaders, they will be able to drive the change that is needed within the industry to improve healthcare delivery within and outside of South Africa. So the COVID-19 pandemic, it's really been something nobody thought we would live through. We've always studied about pandemics and outbreaks. However, having experienced one firsthand has been a remarkable journey, to say the least. At the outset of the pandemic, nobody knew what to expect. We were, as healthcare practitioners and as an industry in general, we were really pushed to a revolution that was actually coming. So things like the fourth industrial revolution, technological drivers of change, all of this has been in the pipelines for years to come. And the pandemic has actually pushed us forward to make that change. And these are changes going forward. Post-pandemic is going to remain within the industry and the way in which we practice health. I think we've realized as an industry that through all the challenges the pandemic has posed upon us, we are much more resilient than we ever knew we would be. And in that sense, we've been able to adapt very quickly and make the necessary changes and stretch each and every one of our capacities into roles that we've never performed before. As clinicians, becoming leaders, managers, decision makers, and vice versa. We've had ancillary staff perform clinical duties in times of need. And it just goes to show how togetherness and teamwork can take an industry a long way. Reflecting back on the pandemic, it's certainly taken its toll on the workforce itself, and not just the doctors and the nurses who are essentially exhausted and burnt out at the moment, but it's developed a sense of belonging for everybody that's experienced the pandemic. And there's a lot of personal stories that have come out of the pandemic as well, in terms of we've all been affected not only by our patients' journeys, however, we've all had loved ones and families and friends and colleagues that have also been affected by the illness itself, let alone managing what the pandemic has posed upon us. So I think what South Africa has to take out of this pandemic is that we have realized that it's time to leap forward and to take these new challenges of technological, healthcare, and industrial revolution seriously, and to build stronger, robust systems so that we can take our healthcare forward and provide healthcare equally for everybody in the country. So I believe I'm a philanthropist, not in the sense that I have a lot of money to give out, but philanthropy and healthcare share common goals in the sense that both are directed towards betterment of lives for the people that you're aiming to help. And whether it be of monetary value or of making somebody feel better or of improving somebody's health to then improve their own lives, healthcare aims to do one and the same, and that is to improve life, improve societies, and improve quality of living for all the people we reach out to.